There we go. That's the sound that I'm familiar with.
Okay, it looks like we're ready to go.
All right, great. Thank you, Nick. Good morning, everyone, and thank you for joining us for our monthly COVID-19 Empower Hour here at African Services Committee. If you're joining us here for the first time, the COVID-19 Empower Hour is a monthly discussion on COVID-19 related topics, where we talk about how to keep yourself safe from COVID-19, how the vaccines work for COVID-19, common myths surrounding COVID-19, and where we also answer any questions that members of the community may have. They can call in at any time, or they can ask their questions in the chat and we'll answer them at the end. My name is Kenneth Cruz. I'm a community health worker here at ASC, and I'm joined by Mariam Traore, who is our outreach specialist here as well. We'll be hosting this month's English session for June. And for those of you who are new to the series, I'd like to introduce African Services Committee, what we do in the community, and the resources that we offer to community members. But before that, if you prefer French or Spanish, we will be hosting the French session. I believe that's going to be tomorrow. And then the Spanish session will be this Friday. So stick around for those days if that's the language that you prefer to hear all this information in. So a little bit about African Services Committee for all of those who are joining us for the first time. African Services Committee is a multi-service human rights agency in Harlem dedicated to assisting immigrants, refugees, and asylees from across the African diaspora. So some of the services that we provide free and confidential health, housing, legal, social welfare, education, nutrition, and advocacy services, regardless of your immigration status or ability to pay. All right, so a little bit about the agenda for today. We're going to talk about the resources that we offer, some news related to COVID-19 as of June 14th. We're going to talk a little bit about the COVID-19 alert. So where is it at now? What does it mean? And given that alert, how to protect ourselves. But first, let's start with the resources that we have to offer. What resources do we have to offer? All right, so here we go. For COVID-19 testing, let's see.
Take over.
Yeah, you can go ahead, Mary.
Okay. Yeah. All right. Yeah. So hello, everyone. Like Kenneth said, I'm Mariam Traore. I'm an outreach specialist here. And just to give you some information on some of the resources that we offer here at African Services. So unfortunately, we no longer offer PCR testing here at the agency. We used to, but now we do have at-home COVID test kits to give to our clients. And if you need any of the test kits, please feel free to call African Services at 212-222-3882. And we can provide you information on how to get here if you don't know, and also be able to provide you with the at-home test kits. Also, if you have any questions about whether to find testing sites or other areas where you could get home test kits, feel free to also call us on the ASC COVID-19 helpline at 706-502-9163. We do have English speakers, we have French speakers, we also have Spanish speakers, and some other African native language speakers as well. So for Spanish, you can also refer to this number here at 862-248-2864. And if you don't reach us, please feel free to leave a message or send us a text anytime, and we will reply back to you. So for vaccination, we have a team here who help clients and those our community members who are interested in scheduling a vaccination appointment. So whether it's for your first dose, your second dose, or any of your booster doses, we are here and we're able to sit down with you or talk with you over the phone to schedule your vaccine appointment. And of course, this vaccine site, we will try our best to help you find a vaccine site that is near your zip code and near your home. in order, or near wherever location is convenient for you. So feel free, like I mentioned earlier, the numbers that we have, we'll show them again later. You can contact us or come to African Services in order to have someone help you set up this vaccination appointments. Also here at African Services Committee, we also have vaccine events for each month, where there's a day we dedicate to from usually the time is 1:30 to 4 p.m. And there are all vaccines of that are given as well. So first dose, second dose, and booster doses as well are accessible. And we have Pfizer, Johnson & Johnson, and Moderna. And the Pfizer vaccine is also available for children aged 5+. So please follow us on social media. Check out our website, African Services Committee, and just to stay up to date to know when these vaccine events will be held. And for now, the talk has been around second boosters. And so for those clients clients that are eligible for second boosters, which would happen 4 months after their initial boosters, are those that are 50 years and older, and those who are 12 years old and older as well, and are moderately or severely immunocompromised. So again, those who are 50 years and older, and those who are 12 years and older who are moderately or severely immunocompromised. So it is recommended that those who fall under those categories take the mRNA vax dose for the second booster. It's also recommended for those who are 18 to 49 years old and receive the Johnson & Johnson vaccine for their primary and booster dose, that it is recommended for them to also take the mRNA vax dose for their second booster. So some of the COVID news that we have are, in terms specifically of the alert level. So over time, there's low, medium, and high levels of that. We are aware of how severe COVID cases, or how many positive COVID cases are here, specifically in New York City, because we are based here and our focus is on here. For right now, still the COVID-19 alert level here in New York City is still at a high. And that means that COVID-19 cases, we're still on alert high, but COVID-19 cases are decreasing in New York City. So that is the goal. That is what we want. We want the positive COVID cases to decrease over time in order for the alert level to go back to low. So far this week, 238 cases per 100K people in the last 7 days, which is a lot better compared to how it was in the last few weeks and few months. And COVID-19 hospitalizations are now stable. So to give you some more numbers, 10 people admitted to the hospital per 100K people in the last 7 days. In addition, hospital occupancy is stable as well, given that 4.86% of inpatient hospital beds available are occupied by COVID-19 patients. But there is still high community spread. So therefore, we want you to continue to stay up to date with your available vaccines, So whether you have not started your vaccine series, please do. Again, we are here to help you. If you need a head start and you're not sure where to start, stay up to date with your boosters. And now that the vaccine is also available for children under 5 years old, please also find out or call us or and speak to your pediatricians in order to get more information about that. And then our other recommendations would be to continue to wear high quality face masks in public indoor settings. So those masks that, when we say high quality, that includes KN95, KF94, and N95 masks. And if you do want to wear a cloth mask, please do you wear the cloth mask on top of a surgical mask, and the surgical masks are the blue masks usually. So please feel free to also get tested Again, if you are more interested in home testing kits, we have that available here at African Services Committee as well. There are public libraries and some other locations that also provide home testing kits. But also isolate yourself at home if you've been recently exposed or you feel like you have symptoms of COVID-19. So just stay alert and keep yourself updated about information with COVID.
Yeah, thanks, Mary. I really appreciate that. And you mentioned some things, or you touched upon some things that we're going to get into soon concerning the vaccines that have been made available for kids under 5. But first, I want to talk to people about how to protect yourself given this COVID-19 alert level. You've touched upon it also with the mask guidance, with getting vaccinated, but there's some other steps that we can take in addition to prevention. So if you believe you've been exposed, as Miriam was saying, you can pick up these free at-home rapid antigen tests at African Services Committee, of course, if that's where you prefer, but they're also ubiquitous, so you can pretty much get them anywhere at New York City museums, libraries, and they're free of charge, of course. Also, per the New York City Department of Health, everyone can receive 2 sets of 4 free at-home rapid antigen tests by mail. So if that's something that you're interested in, you can visit covidtest.gov or call the number on the screen and just get that process set up. And this is for anybody who's in the US, regardless of immigration status. Now, if you tested positive for COVID-19, there are a couple options in case you're not aware. So there are the test to treat, which tends to go unnoticed by people. Test to Treat is a federal website that finds locations in your area that provide free COVID-19 treatment, including antiviral treatment, which is pretty sought after now, given the emergency authorization of treatment like Paxlovid. So what you can do is visit the link on the screen, provide the zip code, and what they'll do is just find a location near you. And based on a couple factors, they can find a location or tell you that there's a location near you that can offer treatment and dispense the treatment, or that can only offer the treatment, or they have all 3 where they can offer it, dispense it, and they have like a provider to evaluate you. So just go on that website. It's aspr.hhs.gov/test-to-treat, and you can just find where the zip code locator is there, and just put in your zip code and it'll just spew out a location that's near you. And there's also the call a provider option in addition to test-to-treat. So a lot of residents of New York who don't necessarily have a healthcare provider, they can, they've asked about, what are their options? Basically, they can connect with a healthcare provider free of charge, regardless of the healthcare that they have, if they have any healthcare. And these healthcare providers can evaluate over the phone, help determine what kind of treatment you need, including the antiviral treatment, if that's necessary, and go through the additional steps of trying to figure out what's best for you given your COVID state. So like I said, that includes antiviral treatment, which can be sent to a pharmacy or to your house within 24 hours, actually, and any other medical guidance that they can provide to you. So feel free to call the number on the screen, 212 COVID-19, to access this resource. So the most recent, probably most impactful news concerning the COVID-19 vaccines have been related to children. So there are 2 things to address. Children who are of ages 6 months to 4 years, according to the New York City Department of Health and recent CDC COVID-19 guidelines and FDA approval. The COVID-19 vaccine has recently been authorized for children 6 months to 4 years. So for parents seeking to vaccinate their children, they should expect vaccines to be made available after June 22nd, sometime soon. There's not given set in stone guideline per se. The Department of Health in New York City recommends just visiting the page on the screen that I hyperlinked for updates regarding vaccine availability for this age group. Given that it's so recently authorized, they're trying their best to make it as readily available as possible. So my suggestion, or our suggestion, would be to just go to the website and check it regularly. But it should be soon. And if you're interested in getting your children vaccinated and they're within this age range, definitely call your child's regular pediatrician, healthcare provider, to see when that could happen. And then there's also the topic of boosters for kids. So according to the DOH for New York City, fully vaccinated children ages 5 and older are recommended to receive at least one vaccine booster. So that goes hand in hand with what we said earlier about how many months out you have to be to receive your booster. The only thing now is that the recommendation is to receive at least one vaccine booster for all the children who fulfill the eligibility requirement of being that many months out from the primary vaccine series. So, talk to your pediatrician, talk to your child's healthcare provider if you believe that your child's eligible, so that they can receive this vaccine booster. In addition to all of that, we at African Services Committee, also in partnership with Ryan Health, have a vaccine event on June 29th from 1:30 to 4:30 p.m. This will be held at our office at 429 West 127th Street. And if you're interested in getting vaccinated or getting one of your friends or family members vaccinated, somebody that you know vaccinated, in addition to blood pressure screening and depression screening, there will be on staff healthcare providers who can assist with these things. You can call the number on the screen, 1-862-248-2864, to set up an appointment. Or if you have any questions regarding this event, you can also call that number, English, Spanish, and French. And you can also just show up the day of. We do recommend for appointments to be made, but if that's not possible for whatever reason, we are taking walk-in appointments. You would just have to wait a little bit longer if there are other appointments made during that time frame that you come in, but it's certainly possible. So again, it's on June 29th from 1:30 to 4:30 p.m. At 429 West 127th Street. And feel free to walk in if you're unable to make an appointment, but appointments are definitely recommended. And we will be offering, per usual, the Moderna, the Pfizer, and the Johnson & Johnson vaccines for all initial doses, booster doses, if eligible. So that includes the first dose and the second dose. Yeah, and I think at this point, if there aren't any questions, or if you have any questions, you can submit them, or comments or concerns, you can submit them in the Q&A box. If there are any questions, we'll answer them, but there don't seem to be any right now. So maybe we'll just wait a couple minutes if there are any. And yeah.
Yeah, I don't think there seems to be any kind of.
Yeah, that seems to be the case. Just fine, perfectly okay. So if anybody has any questions, they can always call the numbers on the screen for African Services Committee. Again, I'll go back to it just in case, if this allows me to go back. Yes, so you can call 862-248-2864 if you have questions regarding the vaccine event or vaccines in general. This is also, again, the details for the vaccine event. For testing, you can call the number on the screen here in English and French if you have any concerns. You can also reach out to us at codevaxoutreach@africanservices.org if you prefer email. That's all. So for any further updates regarding the COVID-19 Empower Hour series for next month, just follow us at African Services. And that's where you'll get the most up-to-date information. So please follow us there if you are not doing so already. And that's it. We'll see you hopefully next month. And again, just to remind everybody again, we have a vaccine event on June 29th from 1:30 to 4:30 p.m. Thank you so much.
Thank you.